Dr. Gurdasani, thanks very much indeed for your time today. And I want to start, if I can, with that rather extraordinary calculation from the WHO that half of Europe will contract COVID in the next 6 to 8 weeks. We keep hearing that Omicron is milder. So just how worried should we now be?
I think we should be very worried. I mean, the fact is that we've seen millions of people get infected across the world, and this is leading to mass infection, massive disruption, and overwhelming healthcare services across the globe. So, the fact that it might be slightly less severe than Delta or potentially less severe because it's also disproportionately affecting people who have been vaccinated doesn't mean that it's not going to affect people, and doesn't mean that a lot of people aren't going to get hospitalized, and some of those are going to die. So we do have to take this threat seriously. It's certainly not like the flu because it's affecting huge numbers of people all across Europe every single day and in the US, and the disruption caused by that, even to healthcare services, is going to be massive.
There may, though, be a nugget of good news here, just in the sense that if this figure is correct, that 50% of Europeans are to contract COVID, that surely we will be that much closer to a degree of herd immunity.
I mean, that's a narrative that's been used many, many times for different variants. But what do you do when the next escape variant comes along? For example, in the UK, we were told by our scientific leaders that people getting infected over the summer would make us have a better winter. But what happened was that Omicron, a variant that escapes prior immunity, better came along. I mean, we've had more than 90% antibody levels in adults in our population in the UK since July 2021. But we've seen huge numbers, tens of thousands of deaths and millions of infections since. So this idea that we will attain herd immunity because many people will get infected for SARS-CoV-2 so far has been a myth, and no country has attained herd immunity for any long duration of time so far, because this virus is very, very flexible and is evolving more and more towards escape.
It's evolving more towards escape, you say. Does that mean, therefore, that COVID, in your view, is less likely to mutate into more mild variants, and actually the picture isn't looking as rosy as some would like us to believe?
So there's no pressure on this virus to mutate to become milder, because we need to remember that it actually infects people early on prior to people becoming seriously ill and dying, which means that the pressure is actually to maximize transmissibility. So that can go either way. It can mutate to become more severe, as we saw with Alpha and Delta. It could potentially mutate to become less severe, but there is no guarantee on that. And even if it did mutate to become less severe, the sheer number of people impacted by it escaping and creating new susceptible populations that cannot be sufficiently reduced in terms of infection by vaccination would still lead to massive impacts at population level. I mean, in the UK, for example, we are seeing 2/3 the level of daily hospitalizations we saw in the first wave, and that's despite vaccines and boosters. To me, it feels like the impact of vaccine boosters, rather than pushing us towards doing better with outcomes, has helped normalize a very, very high level of infection, so that outcomes aren't improving that much per se, but we're tolerating much higher levels of infection, which of course means much more long COVID, which we're seeing in the UK now.
Dr. Deepti Gurdasani, unfortunately we're out of time, but thanks very much indeed for your analysis today on the programme.